Feel it, it's really soft.
那早上就是那个他们抱家庭进去以后，他就让他闻那个笑气，然后让他睡着。那睡着以后，他就把那个这个静脉针就打进去那个家庭的手臂的静脉，这样。那他是说，奶奶可以稍微感觉一下，就是这样软软的那个塑胶的那个静脉管这样子。
The one that goes right here in her wrist is for an arterial one that we can look at her blood pressure beat per beat. And another nice thing about it is that you can draw labs off of this without having to poke her.
So this goes through, not through the vein, through the artery.
This goes through the artery, correct.
他说这个进去的是动脉，所以他可以测他的血压。那除了测血压，还可以抽他的血氧，测他的血液的氧气浓度。
So it's nice though that we can get the labs off of it, so we don't have to poke her, so she won't even feel it.
所以像以后如果说他们要测血液的一些检查，就从这边弄出来，不用再去打静脉。
And then she's also going to have another IV right here in her neck.
他家庭还会有一个那个静脉管，是从脖子这边。
And this goes into a bigger vein that lets us give more concentrated medication. And it lasts longer, so we don't have to poke her again.
那这个是从比较大的静脉进去，那所以如果说直接要给药在心脏附近的话，就从这边就做，所以他们就不用这个管子也是留在那儿，所以就不用再每次都要再打针这样。
So once they get those lines in, then they're going to give her so much pain medication that it makes her not want to breathe, because we don't want her to feel anything.
那他们就给很多药，让他就是比较没有感觉到痛。那可能这些药会影响他的呼吸，因为整个就让他睡着这样子。
It's not that she can't breathe on her own. It's just because we've given her so much medication, so she doesn't feel anything. It makes her drive to breathe.
不是说他不能呼吸，那只是说给他这么多药，还有可能会影响到呼吸的状况。
So what we have to do then is put a little, it's like a straw that bends. We need to breathe for her because she's got all this pain medication on board. So this goes right into her trachea, which goes right to her lungs, and then we can breathe for her.
所以呢，因为要帮助他呼吸比较平缓，所以他们就放这个管子，那是从 from the mouth，
goes in the mouth，
从嘴巴那插进去到气管，然后会到肺，主要到肺的地方，然后这个还会接上一个呼吸，可能有个呼吸器，然后帮助他呼吸，这就是呼吸的一个管子。
Okay. So this is just because we've given her so much pain medication. It makes her not want to breathe. So she'll have that in until she wakes up.
那等她整个醒了以后，那醒了之前，这个管子一直会在。
Okay. So then Dr. Fox, when everything's ready and the team's there, they're going to do an incision right here in the middle.
Okay. 他现在在讲他手术的状况。就等这个管子插进去以后呢，那个外科医生就直接从中间的地方开一个手术伤口。
And they're going to get to the heart, and he's going to do the surgical repair.
然后医生的话就从那个伤口直接进到心脏的地方去修补那个家庭的一个洞。
Right before he starts, they'll take a little catheter that goes down her esophagus, her feeding tube, when it goes down there, and it will take a better picture of the heart. It's called a transesophageal echocardiogram. So before they start, they do another picture of the heart to make sure that everything that they're looking at is what they see.
在外科手术真的开始动刀的时候，他会从食道的地方插一个东西， 然后一直插到心脏附近，那再照一个相。那他说这个照片呢，就是可以比较看到心脏整个的状况，这样再确定他要修补的东西。
After the surgery is done, they're going to do another picture of the heart to make sure, do another transesophageal echocardiogram, take another look at the heart from the inside, and make sure that the surgical repair is exactly what they want it to be.
那等整个医生就是整个修补完了以后，他还是就是刚刚那个管子可以再照一次相，那确定整个都有修补完毕。
If anything needs to be fixed at that time, they'll do it there. If they see it, they'll do it to make it perfect.
如果说照的时候发现需要再修补的话，他当场就可以马上再修补。
And once they're happy with the surgical results, they'll close up the chest.
那等他就是照片照完，结果出来，他觉得修补得很好，他就把那个伤口缝起来。
And because Dr. Fox did so much work inside of the heart, she's going to have a little tube. It's called a chest tube that will be here. Because if there's any blood that remains in there, it makes it harder for the heart to beat. So we want to watch that for any bleeding, and every child that has heart surgery has this chest tube drain.
那因为外科医生呢，在心脏那边就是修补啊、缝合啊，做了很多就是手术方面的动作。那可能有一些血液啊会在附近，那他需要有接一条这叫做胸管，那从心脏附近的地方，就像引流管一样。然后从胸腔方面出来，那所有里面的血液啊，或一些其他的引流液，就从这个管子这样流出来。
There it is. So this will be all covered with tape.
那这个呢，会有贴布贴起来这个管子。
Okay. Another thing that she'll have is these are called pacing wires.
OK，那个医生可能会用这个线，这很像缝线，还有一个。
And what they do is they lay right on the outside of the heart. So this little string lays right on the outside of the heart.
这个线呢，就是在心脏外面。
And the nice thing about these, and this is also every child that has heart surgery has these. The other nice thing about this is that if her heart rate goes too fast or too slow, we can dial into what we want her heart rate to be. So we think of them as safety lines.
那这个线呢，不管你心跳跳得太快太慢，那这个线呢都会可以就是可以控制，对，可以知道，然后接到另外一个机器，可以让。
And they're only temporary.
那这个只是暂时的线。
We're going to have a Foley catheter because we want to measure everything that goes in her and everything that goes out of her. So this will go right into her private area here. So it's very light, but this is where she can urinate and go to the bathroom without having to get up.
这个管子呢是导尿管，所以就是因为他们要测量看她的尿量。每天尿量有多少？那这个管子呢，就从那个膀胱泌尿道的地方进去，那就是有一个引流管到一个袋子，让它测它每天的尿量，这样子。那这个是很软的一条线。
So after surgery, they're going to take you down to a little room, consultation room, and you'll be able to give her hugs and kisses, and then speak to Dr. Fox, and he'll let you know how the surgery went.
那等整个手术完了以后，奶奶就可以去她有一个像一个小房间一样，那你可以看到家庭，那可以看她的整个状况，然后顺便那个外科医生会跟奶奶讲大概的手术情况。
And then what we're going to do is afterwards what we'll do is we'll start to come down the pain medications so that she starts to breathe.
那等手术完了以后，那个 止痛药呢会慢慢的减量。
But we want to, sometimes it takes to get this fine balance because we'll come down on the pain medication so she breathes, but if she becomes in pain, then we'll have to go back up. So sometimes it just takes a little bit of time to find that happy balance where she is under pain control and she's breathing well on her own.
那手术完呢，他就是要让他的那个止痛药减量，但是也需要注意他的呼吸状况。那有时候减太低呢，那可能家庭又会觉得痛不舒服，那可能又要加量。那加量的话，可能又会影响到呼吸。所以这两个呼吸跟止痛药，这两个需要找到一个平衡点，那可能会需要一点时间。
So as soon as we can find that balance where she's not in pain, but she's able to breathe on her own, this just comes out like this, and we just pull it out.
那等他找到那个止痛药可以用多少，然后他可以自己呼吸，然后这个管子就可以拔掉呼吸管。
Once we get the breathing tube out, it's going to be a little while still till she can eat. We want to make sure that she doesn't need the tube back in, and then when they have anesthesia, it makes everything slow down, so we need to make sure that her stomach's working before we start to give her food or water. So it's a little bit of time, so we have to wait till the doctor.
他呼吸管拿掉以后呢，那因为整个胃肠就是算是麻醉的关系都没有办法蠕动嘛，那可能需要几个小时没有办法吃东西。
Okay. And then we'll watch the chest tube, for a couple days. And once we feel as though it's at a small amount, either Dr. Fox or I will just pull it out. And it just comes out and you just put a bandage over it.
那等大概观察1-2天，等那个引流管几乎都没有东西出来了，那表示复原得很好。那护士呢，或是医生 Dr. Fox 就会直接把管子拿掉。那他刚刚就是讲说拿掉呢，他就是直接拔起来，那直接贴上那个一个胶布或是纱布，就这样他就自己会复原。
And when she starts eating enough, then we'll take this away.
如果说他吃得很好，那不需要再打点滴，那静脉的地方就不要拔掉。